Hi, my name is Ashley Randall, and it is September 10th. I'm an 8th semester student. This is my trach video. First, I will come in, hand hygiene, introduce myself to the patient. Hi, my name is Ashley. I'm going to be your nurse today. Can I get your name and date of birth? Thank you. Compare it to our armband. Explain the procedure. Okay, today we're going to section out your trach and then also clean it out. Do you have any questions? No. Alright, and she is on oxygen, so I would increase the oxygen to hyperoxygenate her because I will be taking that out for a little bit, or taking it off for a little bit. Also, while I'm suctioning, can you raise your left hand for me if you're needing me to stop for any reason? Yes. Alright. So I will put this on your chest just so that you don't get dirty. Alright. The first thing I will do is suction. Pour some sterile saline into there. Sterile gloves on. And then if they were to roll, I would go get new ones, but for the sake of the video, I will not. Alright, so I will roll this into my dominant hand, the hand I will be using to actually put it into the trach. And with my non-dominant hand, I will break sterility and attach this to it, and I will turn the suction on continuous, and it'll be set to anywhere from 80 to 120. So with this hand not being sterile anymore, I can also go ahead and take this oxygen off of her. Lubricate this, and I will advance it until I meet resistance, and then I will rotate and intermittently suction it for 10 to 15 seconds, and I will keep doing that until the secretions are cleared out. But she only needed the one time. So while she's sitting here, I can go ahead and put the oxygen back on her. And I am finished with this. Now I will be cleaning the inner cannula, and I will go ahead and take this off. And this one rolled, so I would replace it, get new ones. Okay. Get all my stuff ready. And I would pour saline into the 2 compartments. And then I would pour peroxide into the 1 compartment in the front. So for this, I will make my left hand dirty again. And you just pull and put this in the same compartment with the peroxide and let it sit a little bit because that'll break down any of the secretions that are on it. I will get the pipette and clean over a trash can so I'm not dirtying my sterile field. Cleaning the inside and outside. Alright, and then I will place this into the clean trash. And then once that's rinsed out, I will pick it up with my clean hand, tap it on the inside, get any of the excess moisture out. Okay. And I will put that back, making sure that it snaps, and it did. And then I will take this, get it wet, just clean around the outer portion, get any of the secretions that are there. Now I can take this dressing out so I can clean underneath it too. Once the external part's clean, I can take gauze and dry off any of the excess moisture just so that there isn't any skin breakdown. And I would also, if at this point, I will be doing the V dressing change, and this hand is still considered dirty. So I will just put that in there. And now I can go ahead and change my gloves to clean gloves, but for the sake of the video, I'll just leave these ones on. make sure I have one hand on the trach, or on the trach the whole time that it is not secured. That way, if they cough or anything, I have it in place. And I will make sure there's at least room for 2 of my fingers between the collar and the neck. Make sure her oxygen is back on and turn it back down to the normal amount that it was on. Take this off of her. And you always want to make sure you have an obturator on the side of the bed just in case, or on the wall, just in case that the outer cannula were to, were to pop out if they were to cough, if I did not have good control of it when I was changing it. I will document how the patient tolerated it, the color and amount of the secretions, and the date and time that the care was given.